Hi, I'm Nurse Barb, and this is your daily dose on women's health and your periods. Do you ever notice that whenever you see your women's health care provider, they're always asking you, what was the date of your last menstrual period? And if you can remember, you write it down, you might guess, or maybe you're keeping track of it on an app. And then you're wondering, well, I wrote this down, they seem obsessed by this information, and then nobody asks me about it. What's going on there? Well, what happens in our profession is that we're always looking for clues about whether there's a problem with a woman's menstrual cycle or with her overall health. And knowing the last menstrual period is one key piece of information that we use here in our heads to try to figure out if there's something that's of concern for you both now and in the future. So let me talk to you a little bit about why we talk about the first day of your last period, no matter what your age is. So when you're a teenager, it's very normal to have very irregular periods, and for those periods to come every 30 to 60 days. Very few people of any age have a period that comes on the dot every 28 days. So that's not very typical. Most women have a range where their periods will come anywhere from about day 25 to 45. And we count from the very first day of bleeding in one cycle to the very first day of bleeding in the next cycle. And that's how we count the days in between. So teenagers often right after puberty, as their hormone levels are starting to balance out, they'll have very irregular cycles. But if they go more than 3 months or 6 months without a period, that's a cause for concern. And that's why we ask about that, because we want to know, well, it's possible that she could be pregnant. There's a possibility that there's other hormonal issues that can be impacting her periods. We also want to know whether or not it's been 6 or 12 months without a cycle, because there's other things that we work up. As women get older, when we ask if there's a long interval between periods, we want to know, is this going to possibly affect her ability to get pregnant? And as women get to be in their 40s and 50s, we want to know, all right, how often are you having cycles? Because that can be a sign of perimenopause or even menopause. So what impacts our cycles and why are they so irregular? Well, about 1 in 8 women will have a thyroid issue, and the thyroid is that gland in your neck. It not only impacts your weight, whether you feel hot or cold, your metabolism, but it can also impact your periods. So if there's a thyroid issue, oftentimes women will have irregular cycles. Other hormonal causes could be polycystic ovarian syndrome or PCOS. Some people call it PCOS. That's where there's a hormonal imbalance, and women can go 3, 6, 12 or more months without having a regular period. And that, of course, impacts fertility, and there's lots of other symptoms with PCOS or PCOS. When women get to be ready to have babies, if their cycles are really, really short, they may not have a long enough cycle to be able to get pregnant or stay pregnant. And so that's another important issue. Also, if women's periods are coming more frequently, it may be a sign that there's a polyp or a fibroid that's causing some interruption in the lining of the uterus. And that means it's time for me to show you my uterus model. So I have one here. And this uterus model, your uterus is about the size of your fist. And this one has some handy magnets on it, so I can pull it apart and show you what's going on inside the lining. Most irregular periods are caused by ovarian dysfunction. That means that the ovarian hormones are not regular, and that's what causes it, especially when women are younger, around puberty, and as we get older, around perimenopause and menopause. We're not ovulating regularly. That means we don't have a balance of estrogen and progesterone, and that can cause irregular cycles. In addition, what happens is that the lining of the uterus here it can be affected if there's a polyp or a fibroid that is either on or in the lining, and that can cause irregular bleeding. These are much more common in women who are in their 40s and 50s. So when we talk to you about your last menstrual period, we have a list in our brains of what could possibly go wrong, and that's how we're trained to think about problems that may need a solution. Of course, one of the most common reasons why a period may be delayed is when a woman is pregnant, and there's many women who use contraception who still become pregnant every year, or women who use contraception a little bit irregularly who become pregnant. Also, as women get older and they're in perimenopause, they may not think they're still fertile, and that's when a lot of unintended and accidental pregnancies can occur. Another reason why women may skip periods for 3, 6, or even 12 months or longer can be if they're over-exercising or if their body weight is too low. We know that if our body weight is too low, we don't have enough fat in our system. And I always show patients my arm because when we have fat in our body will aromatize or take the fat and turn some of the substances in there into estrogen. Well, if we don't have enough body fat, that means that our estrogen levels can be quite low and we may not have enough to ovulate every month. And if we're not ovulating every month, we may skip a period. That's why a lot of athletes and women with eating disorders may skip periods for 3, 6, 12 or more months. So if you're skipping periods, if you haven't had a period in more than 3 months, that's when you talk to your healthcare provider. And here's some of the other times that you should have this evaluated. If there's bleeding for more than 10 days, if there's bleeding in between cycles, if there's bleeding that happens regularly, but it comes more often than every 21 days. And remember, we count from the beginning of one cycle to the beginning of the next. If women are bleeding heavily, if they're soaking through a pad and or a tampon or any kind of protection in less than an hour, and that's going on hour after hour for a day or more, that's a time to be evaluated by your healthcare provider. And of course, for any woman who hasn't had a period for over a year and she's menopausal, over 50, and she hasn't had a period for over a year, and then suddenly 2 or 3 years later, she starts having bleeding, that also needs to be evaluated. So I hope this answers your questions about why we as healthcare providers are so obsessed with your last menstrual period and what we do with the information. And if you've liked this video, I hope you'll click on like and subscribe. You can also find more information at my blog, nursebarb.com. I hope this has been helpful. Take care and be well.